Hello ladies and gentlemen out there, my name is Kiza Martha as usual, and you can call me Mama Family, my business name. Mama Family touches a family as you know it, and I make sure that my message I give can help a family or two there, or marriage or two, because a dysfunctional marriage can cause a very big community problem, or sometimes to the children of the family. I've been talking about men, and the sexual organs of men, and how they are responsible for making a marriage a good place to be, or making marriage dysfunctional. Today, let me talk about women as well. I'm not gender biased, I'm rather gender balanced. The topic today is the anatomy of the vulva. A vulva is the external female sexual organ, and I will not use the dildo like I used for men, because I know out there the community does not want so much to know and to see the parts of a female organ being exposed. I have my plastic things to show, but the plastic, I don't think people will be very comfortable with it, so allow me to use my fist. I'm going to use my fist to demonstrate what I want to demonstrate in the anatomy, but you will be able to see what I mean, and these parts shall explore all of them. So this one, take this one as my fist. Let me, it will serve the purpose. Assuming that this one is the whole a vulva of a female part, when you come down here, you find that here it could be the glands here, the part that is hairy, so hairy, and we remove the hairs most of the time. Others can decide to keep them, but the majority remove the hair from here, and this part is the mons pubis here. As you go down here, there are two we call them legs of the clitoris. Those two legs hold tightly the clitoris here, and this one, the sharp end here, is what I will call, others think it is the clitoris, but actually this is not the clitoris. This one, the clitoris is covered in there. Here it is the clitoral hood. It is the foreskin that is here, and inside there is where the clitoris is. The clitoris is the most sensitive part, created for sexual arousal, and nothing so big. Actually it's for sexual gratification, sexual arousal, and it helps a woman to reach orgasm very fast. Women without it may not actually have this orgasm of the external one. Even the vaginal orgasm might be very problematic without the clitoris. And here, this part and this other part is what I may call labia majora. They are the inner, they are the outer lips. And what I have created here are the inner lips, and we call them the labia minora. There are two. Some people elongate them. They pull out here and pull out here. The whole thing becomes long. In some cultures, it may be as long as this segment of the finger, while others measure the second segment of the finger. And that's how different cultures take sexuality differently. And when you remove the foreskin from the tip, that one will be called female circumcision. Some cultures and religions do female circumcision, and they expose the glands. The glands here, like of a man, it is exposed through circumcision. The foreskin is removed, and it is almost like that, the glands of a male penis. Just right after, once a woman exposes herself open like this, from the north to south, you see three holes. Right after the clitoris down here is the urinary opening, and then just here down is the vaginal opening, and that one is the biggest. As you continue down, there's the anus. Between the anus and the vaginal opening, there's a frenum. That one, frenum, is a part that is hairless. It is in most people between your legs, between the vagina and the anus. It is very smooth. It is hairless. It is very sensitive to touch also, because a lot of nerve endings are around here. And with the clitoris, there are a lot, thousands and thousands of nerve endings here, and also tissue and the network of erectile nerves that will make clitoris very sensitive to touch. It depends on how one touches. Some people use the tongue around here. Others use a finger, and if you are using a finger, make sure that the finger is very smooth, because the part is very sensitive. While others use sex toys, others use the penis of the very man. In sexual orientation, the man can interact with it using his penis, or for penetration also. those who can decide to penetrate here in the vagina, still the clitoris will play its part, because it will be erect enough if a woman is sexually aroused. The other two legs I told you and other external parts there will just push in blood, and then there will be a lot here in if it is erect. For women who use female masturbation, they play around here and they find gratification, and they find themselves finishing. So, ladies and gentlemen, all around here, the valve area can be stimulated. What makes it a problem is that in some cases people don't know how to touch and where to touch, and also the hygiene of those ones who touch. It is very, very important for whoever wants to know the proper touches and where to touch first, because we have seen men who don't want to explore their ladies. You'll find that they just fix the penis here in the urinary opening, and that one makes it very, very painful. We have talked in the previous videos about dyspareunia, that is painful sex. Sometimes it happens because some people don't know where to touch and they fix it there. That one is a very small thing, and it only enlarges a little during urination and it goes back to its natural form. The bigger one is the vagina, where penetration of the penis goes, and the anus, of course, the vagina, the urinary opening is for urination, passing out urine. The vagina is for sexual intercourse, also for menstruation and for childbirth. So it is wide enough and elastic. That is where the whole work should be done. And down at the anus, that one there is no work. Sometimes people do it, the anal sex, depending on how your sexual orientation is. I'm not saying anal sex is bad if that is what you prefer with your partner. I don't mind, but in the next video now we shall see how these parts here become a marriage issue, a marriage problem, because they are touched either badly or they are plucked out. That is what makes it a problem. Ladies and gentlemen, for now, let us stop there with the anatomy, and in another video we shall come up with what makes the female parts dysfunctional and makes it failure for a woman to reach orgasm and enjoy the sexual activity. Visit me at mamafamily.org and we can talk more, or WhatsApp me. Thank you very much for now, and we meet in the next video. Bye bye.